Dealing with problems with close friends and relatives. Some patients have difficulty asking for help. This can make them feel overwhelmed or isolated by their problems. Some find it difficult to say no and find themselves forced to do things they do not want to do. You can help the patient to 1. Solve the problem, and 2. To communicate clearly and effectively. Solving problems with a strategy we call DEAR, D-E-A-R. Describe the situation. Express feelings about the situation. Do not expect the other person to read your mind. Assert for what you want or do not want clearly. Reinforce or encourage the other person to support. DEAR strategy. The DEAR strategy may be more effective if the patient focuses on the current situation and not on past mistakes, separates the other person from his or her behavior, acknowledges the other person's expectations, uses statements such as "I feel sad when you do this," rather than "you make me sad," avoids using words such as always and never. Practice these techniques in role play with your patient. Try to schedule a session with the person concerned. Ways to communicate. Find a time to talk that is good for the other person. Focus on the current problem or argument and do not bring up the past. Do not attack or criticize the other person. Focus on specific behaviors that are of concern to you. For example, "You hurt my feelings," rather than "You are an unkind person." Avoid using words such as always and never. Instead, say "You interrupted me this morning." Find someone to help you communicate better. This can be someone whom you both trust and respect. Imagine yourself in the other person's position and acknowledge their experience. Say how you feel as clearly as possible. Use "I" statements about how you feel. Example, "I feel angry when you behave like this," rather than "you make me angry."